All right, welcome to another deep dive. We've got a really fascinating one for you today.
Yeah, this one should be good.
Yeah. This time we're going to be looking at art therapy with children on the autistic spectrum.
Oh, interesting.
Yeah. So our main source for this is a book called Art Therapy with Children on the Autistic Spectrum Beyond Words.
Okay.
It's by Kathy Evans and Janek Dubowski.
And what's the sort of main theme, the big idea that they're exploring in this book?
Well, it's really about how art, like the actual process of creating art,
Yeah.
can be used as this different way of communicating,
Mhm.
especially for these kids who often have a really hard time with traditional language.
Right. Makes sense. I mean, art can be so powerful, so expressive, even without words.
Exactly. And, thinking about the authors themselves, it's this really interesting combination of personal experience and professional expertise.
Oh, how so?
Well, Kathy Evans, she kind of came to this through her own experience as a mom.
Okay.
Her son was hearing impaired. And that really got her thinking about these different ways to connect and communicate, beyond just spoken words.
Wow, that's got to be a powerful motivator, going through something like that
It
personally.
is. And then you have Janek Dubowski, who brings in this, wealth of experience as an art therapist.
Yeah, he's actually got a ton of experience.
Yeah, he's been working for years with people with developmental differences, including autism.
So he's really seen firsthand how art can be this bridge, this way to reach people who might not be reached as easily through other means.
Absolutely. So they start the book off by really laying out what these communication and imagination challenges can actually look like in kids with autism.
Right, because it's not always like super obvious from the outside.
It's not. And they point out that even when these kids do develop language, the way they use it is often really unique.
In what way?
Well, you might see things like echolalia, which is where they repeat words or phrases,
Okay.
or they might use language in a very idiosyncratic way, very
Yeah.
specific to them, and sometimes they take longer to process what's being said to them.
Right, that makes traditional conversation tricky, huh? Like that back and forth flow can be disrupted.
It can, and that's where art comes in. It's this more visual, less time-pressured way of expressing yourself.
I see. So it's not just about spoken language, is it? There are these parallels with how these kids play, too, right?
Yeah, and that's another thing they talk about. Sometimes the way kids with autism play can give us these clues about how their communication and imagination might be working differently.
Like, what kind of differences in play are we talking about?
Well, it might be that they're more likely to play alone,
Or,
or they might be really focused on very specific routines or interests in their play.
mm-hmm.
And then there's this really key idea they bring up, which is that making a picture is itself an act of communication.
Whoa, that's a big statement.
It is, right? They're basically saying that when a child creates something, there's this inherent desire for it to be understood.
Hmm. So it's like they're putting something out there into the world and they're hoping someone will get it, connect with it on some level.
Exactly. And they talk about this artist's public, which could be their family or anyone they're sharing their work with.
I see.
And they see this as leading to what they call a tripartite relationship in art therapy.
Tripartite, meaning three parts.
Yeah, so it's like a triangle.
Yeah.
You have the child, the therapist, and the artwork itself.
Interesting. So it's about how those three elements interact, how communication happens within that space.
Exactly. And they're very clear that their approach isn't just some random collection of art activities.
Okay.
It's actually deeply rooted in how we understand child development.
Mm-hmm. And I know they talk a lot about those really early stages of infancy, right? They see that as being super important.
Yeah, they really focus on that period because they believe it sets the stage for everything that comes later.
Like laying the foundation for imagination and being able to use symbols, right?
Exactly. And we know that lots of interventions for kids with autism use visuals, like picture exchange systems and things like that.
Right.
But the book makes a really important distinction there.
What's that?
It's the difference between being able to recognize a picture, like understanding what it represents,
Okay.
and actually being able to create that image yourself.
Ah, I see. So like knowing that a picture of a banana means banana is different from actually drawing a banana.
Exactly. And they're saying that the act of creating that image involves this whole other level of thinking.
It's a more active form of communication, right? You're not just
So-
receiving information, you're actually putting it out there in a new way.
Exactly. And they're really writing this book for a pretty wide audience.
Yeah, I was thinking that it seems like it would be relevant for so many different people.
Yeah, they specifically mention parents, teachers, and anyone who works with kids with autism.
And of course, art therapists themselves.
Of course. They even say that part of their goal is to clear up some of the confusion about how art making fits into play, education, and therapy.
Yeah, that's a good point. I mean, sometimes those lines can get a little blurry.
They can, and so that leads to this really central question they ask, which is, if pictures can communicate without words, can art therapy really help people who have trouble with language?
Yeah, can it truly provide this alternative way to connect?
Exactly, and their answer is a resounding yes.
I mean, they've dedicated their careers to this, so it makes sense.
It does, and they bring in a lot of Janek Dubowski's earlier work here, especially his model of developmental art therapy.
Can you remind me about that model again?
Yeah, so basically he proposed that communicating through images, through these iconic representations, actually develops in stages.
Okay.
And these stages kind of mirror how language develops in typically developing children.
That's fascinating.
Yeah, it is. And he also made this really interesting point about language itself, something he felt was often overlooked.
What was that?
He said that language isn't just about talking to other people, what he called intercommunication.
Right.
He said we also use language inside our own heads, like that internal dialogue we all have.
Oh, yeah, like that voice in your head that's constantly narrating your life.
Exactly, and he called that intracommunication. He was basically saying that for a lot of the people he works with, that internal language might also be developing differently.
So that inner world of thoughts and feelings might be expressed in different ways, maybe less verbally.
Precisely. And the book also gets into how we actually understand pictures.
Okay.
And they go beyond just the surface level, what's immediately obvious.
So there's more to it than just what you see at first glance.
There is. They talk about the manifest content, which is that surface meaning.
Okay.
But then there's also this deeper layer, the latent content, which is all those hidden feelings, thoughts, and ideas.
Wow. So it's like there's this whole world of meaning beneath the surface of the image.
Yeah. And they see this expression of emotions through art as a way to work through those deeper emotional experiences.
I see.
And a big thing they keep coming back to is this idea of the quality of experience, particularly the experience shared between the therapist and the child during therapy.
Oh, so that relationship, that connection is seen as crucial.
Totally. And their whole understanding of how development unfolds is really informed by a few key theories.
Okay.
One is object relations theory.
Okay. Familiar with that one.
Yeah, and there are some big names in there like Winnicott and Mahler.
Mm-hmm.
And then there's this more recent work in psychobiology from people like Trevarthen and Shore.
Yeah, I've heard of them.
And then they specifically highlight Daniel Stern's work on intersubjectivity.
Which is that deep mutual understanding, like between a mother and her infant.
Exactly. And it's important to note that they're not saying they're doing traditional psychotherapy.
Right, right.
They're using these developmental theories to understand and guide their work, but it's not therapy in the conventional sense.
Makes sense. Okay, so moving on. What about early development and the concept of symbolism? That seems pretty central to their whole approach.
It is, and they start by talking about how incredibly important that early relationship between an infant and their primary caregiver is.
Oh, yeah, that's like the foundation for everything, isn't it?
It is, and they talk about this back and forth interaction, this reciprocity,
Okay.
as being crucial for the infant to develop a sense of self, which is something Daniel Stern really explored in depth.
Mm-hmm.
And then they bring up this fascinating idea of transitional objects.
Oh, like that special teddy bear or blanket that a child just can't live without?
Exactly. And they're drawing on Winnicott's work here.
Okay.
Winnicott saw these objects as this kind of bridge between a baby being completely dependent on their caregiver
Okay.
and them starting to become more independent.
I see.
These objects are like the first things that are not me for the baby.
So they represent that separation, that step towards independence.
Yeah, and they can actually stand in for the absent mother.
Wow, so these objects actually become these early forms of symbolic representation.
They do, and the book talks about how symbols can actually help to reduce anxiety.
How so?
Because they allow us to hold on to something important even when it's not physically there.
Right, like that feeling of comfort and security that a child gets from their teddy bear, even if their mom's not around.
Exactly, and Winnicott called this creating a potential space.
Potential space, okay. What's that?
It's kind of like this psychological breathing room where babies can start to explore the world around them,
Okay,
but also their own inner world of feelings and ideas.
I see. And a lot of that exploration happens through play, right?
Exactly. And then they make this really important distinction between signs and symbols.
Okay. I
Yeah.
feel like I kind of get that, but can you explain it anyway?
Sure, so a sign always points to one specific thing,
Okay.
like the written word cat referring to a cat.
Right.
But a symbol can actually represent multiple things at the same time.
Give me an example.
Sure, so a child might pretend that a banana is a telephone.
Okay, yeah, I've seen that.
So they know it's a banana, but in their play, it's also something else.
Right, so they're using it symbolically.
Exactly. And Winnicott said that this ability to think symbolically comes directly from that early attachment to a transitional object.
That's fascinating. And this all seems particularly relevant when we're talking about kids with autism, right?
Yeah, because the authors have noticed that even when these kids develop spoken language, they often use words more like signs than symbols.
Oh, interesting.
So they might learn that a word describes a certain object or action,
Okay.
but they might have trouble using it in a more metaphorical or imaginative way.
I see. And they connect this back to the challenges with symbolic play.
And they do, and they say that this can lead to a more limited vocabulary for expressing those really complex inner feelings.
Wow, that makes a lot of sense. And they also talk about the importance of physically comforting and holding infants, especially when they're upset.
Yeah, because before, babies have their own ways of coping with difficult experiences. They're completely reliant on their caregivers to soothe them.
Right.
And the way the caregiver responds, both physically and through language, is super important.
It's like they're teaching the baby how to handle those big feelings.
Exactly. And Mahler called this the language of affect.
Okay. But they also contrast this typical use of transitional objects with what Francis Tustin called autistic objects, right? What's the difference there?
Yeah, so Tustin noticed that the way some kids with autism relate to certain objects can be different.
Okay.
Like, a child might be very attached to a specific toy and always need to carry it around.
Okay. Sounds familiar.
But unlike a typical transitional object, it might not be replaceable.
So they're not just attached to any teddy bear, it has to be that specific one.
Exactly. And the way they interact with it might seem unusual, like gripping it really tightly or focusing on a very specific part of it.
And this led her to the term autistic object.
It did. And it raises a really interesting question. If an autistic object takes the place of that transitional object, does it limit that imaginative potential space?
Because that potential space is where that symbolic thinking starts to develop, right?
Exactly. And the authors suggest that this really early stage is setting the stage for later social communication skills.
I see. So if a child doesn't move through those early stages in a typical way, it could contribute to those challenges we see later on with communication, social interaction, and imagination.
Exactly. And they bring in Daniel Stern's idea of the senses of self here.
Which are those different ways of experiencing yourself in the world, even before you have language, right?
Yeah, like the emerging self, the core self, the subjective self, and then eventually the verbal self.
He really highlighted how much is going on in an infant's mind even before they can talk.
He did. And it's right around the time that subjective self is emerging that we see another big milestone,
Which is?
the development of hand-eye coordination.
Oh, so they can start to experiment with drawing.
Exactly. And Stone noticed that this tends to happen around the same time, usually between 9 and 15 months.
So drawing and that sense of self are kind of emerging together.
They are, and that leads us into how drawing itself develops.
Okay, and their first point about drawing is actually kind of surprising.
What's that?
They say that kids don't actually need formal art supplies to start developing their drawing skills.
It does seem counterintuitive, doesn't it?
It does.
But they argue that the world is full of opportunities for mark making.
Like what? Give me an example.
Okay, so they talk about this 14-month-old named Jason,
Okay.
and he was totally fascinated by spilled pudding.
Just put it, okay.
And he was exploring how different movements with his fingers created these different patterns in the pudding.
Oh, I see. So it's about that sensory experience and the child realizing that their actions have an effect.
Exactly. And they point out that this development of drawing often starts happening around the same time that language emerges, which is usually around 15 months.
That timing is interesting, huh?
It is. And they suggest that it shows this need for more complex ways to express and share experiences.
So both language and drawing are kind of emerging out of that need.
Yeah, and then they talk about this idea of pre-representational drawing.
Okay, I think I need a little help with that term.
Yeah, so we often use the word scribble,
Right.
but they feel like that can kind of imply that those marks are meaningless.
Yeah, like they're just random scribbles.
Exactly. So they use pre-representational to suggest that the child isn't necessarily trying to draw anything specific at this point.
Like with Jason and the pudding?
Yeah, it's more about the joy of movement and seeing what happens.
Got it. So the process is more important than the product at this stage.
Exactly. And through this experimentation, kids start to learn that different movements create different marks.
And they build up this whole vocabulary of marks, right?
Yeah. And later on, those marks will get combined into those representational drawings, where they're intentionally trying to draw something specific.
Right, like something from their mind onto the paper so they can share it with someone.
Exactly. And in that way, drawing becomes this more formal way of communicating, just like language.
I see, I see. And there are these different stages that kids go through as they develop their drawing, right?
There are, and the book talks about Victor Lowenfeld's scribble stage, which he said usually lasts from about age 2 to 4.
Okay.
And during that stage, it's really all about the physical act of making marks.
Okay.
And Lowenfeld also noticed that kids sometimes give verbal descriptions to their scribbles.
Oh, like they'll say, this is a house, even though it just looks like a bunch of scribbles.
Exactly. And he called that the name scribble, which is like this early connection between action and meaning.
Cool. What about Leckett's idea of fortuitous realism? I remember that sounded interesting.
Yeah, so he described it as the child discovering the meaning of the drawing in the act of making it.
So they're not setting out to draw something specific, but then they see something in what they've created.
Exactly. And a really simple example would be a child making circular movements with their crayon
Okay.
and then realizing, oh, this looks like a ball.
I get it.
And that recognition of a form, like a circle, can be really significant.
How so?
Because a circle can represent so many things for a kid.
True, like a person or a car or the sun.
Exactly. And this can lead to what they call schemata, which are these more fixed ways of drawing certain things.
Okay, like a formula for drawing.
Yeah, and a classic example is the tadpole person.
Well, yeah, I've seen those. It's like a circle with a face and then stick arms and legs.
Exactly. And they point out that kids at this stage often draw those elements in a very specific order.
So they're not just randomly placing things on the page, there's a method to it.
Right. And they use the example of a child named Jeffrey,
Okay.
who consistently drew a circle, 2 dots for eyes, and 4 lines for limbs.
Okay.
And when asked about a nose, he first touched his own nose,
Interesting.
and then added a 3rd dot to his drawing.
Wow, so there's that real connection between their own body and the drawing.
There is. And even a week later, he followed the exact same process. So that formula was really stuck in his mind.
So it's almost like a ritual, a way of making sense of things.
Yeah. And this stage is also linked to what Winnicott called intellectual realism.
Intellectual realism, okay. What's that?
It's where kids draw what they know to be true rather than what they're actually seeing.
Oh, I get it. So it's like that classic example of kids drawing a house with all 4 sides visible, even though you can only see one side from the front.
Exactly. And they give the example of Jeffrey drawing a belly button on his tadpole person, even though he wasn't looking at a belly button.
Right. He knows people have belly buttons, so he includes it.
Exactly. And by this stage, the kid not only understands that drawing can be this form of language, but they're also starting to build this vocabulary within that language.
I see.
And the more they play and experiment, the better they get at translating those thoughts and images onto the paper.
Makes sense. And they make a really important connection here, bringing it back to symbolism.
What's that?
They suggest that typically developing kids, through their experience with transitional objects, might already have had experiences with symbolic thought, even before they can draw recognizable shapes.
So even before they have the fine motor skills for drawing, they've got that foundation in symbolic thinking.
Exactly. And they say that this might help them to find meaning in the marks they make, even when they're just scribbling.
Okay, so for kids with autism, that foundational experience with symbolism might be different.
Yeah, it might. And this leads into how autism can influence the whole drawing process.
And I know they use the example of a boy named David to illustrate this.
Yeah, so their first impression of David was that he had good visual and motor skills.
Okay.
And he seemed to enjoy making art.
But
he had this really intense focus on drawing animals.
okay.
And it wasn't just a preference, it was almost like an obsession.
Really? Like he would only draw animals?
Yeah, and he'd been doing it since he was really young. And any attempts to get him to draw anything else were unsuccessful.
Totally unsuccessful. And when he did draw animals, his style was very schematic and repetitive,
Okay.
which the author saw as being similar to those repetitive behaviors that are often associated with autism.
Right, right. And what about when they tried to get him to draw a picture of himself?
Oh, that's interesting. He didn't draw a self-portrait.
He didn't.
No, he actually wrote his name instead.
Wow, that's really telling. It's like he couldn't represent himself visually.
Yeah, and even when he did start to draw the outline of a head, he got really anxious and stopped.
But he was able to find comfort in going back to his animal drawings?
He was, almost like he was using them to regulate himself in this new and maybe scary situation.
Makes sense. And over time, they were able to build a bit of a connection with him, right?
Yeah, gradually, and his anxiety seemed to lessen.
And were they able to introduce any new materials?
They were able to introduce paint, which he was okay with,
Okay.
but that underlying schematic way of drawing tended to stay the same.
So even though he was getting more comfortable, that rigidity in his drawing remained.
It did, and this experience really led them to emphasize the idea of interactive art therapy.
Okay, can we break that down? What does interactive art therapy actually mean?
Yeah, so it's really about the therapist paying very close attention to everything that's happening in the session.
So not just focusing on the artwork itself.
Not just that, it's about the whole dynamic between the child, the therapist, and the materials.
And they broaden the definition of communication here,
They
right?
do. They're not just talking about spoken language.
It's about all those ways we connect and respond to each other from the very beginning of life.
Exactly, and they draw on those ideas from Stern and Winnicott about those early pre-verbal ways of connecting.
And they talk a lot about the importance of video recordings, right? To help capture those subtle cues.
Yeah, because sometimes those cues are so tiny and fleeting that you might miss them in the moment.
And video allows you to slow things down, analyze those micro interactions.
Exactly, and they give the example of this child who seemed to be mainly interacting by avoiding contact.
Oh.
But when they looked closely at the video, they saw that the child's movements were mirroring the therapist's.
Wow, so even in that avoidance, there was this unconscious connection happening,
There was, and they also talk about Treverthan's idea of proto-conversation.
which is that early pre-language communication, like between a mom and her baby.
Yeah, and they talk about motherese, which is that sing-songy way that mothers often talk to their babies.
Oh, yeah, I know exactly what you mean.
So the therapist tries to do something similar, paying attention to all the ways the child is expressing themselves, even without words.
And reflecting that understanding back to the child, right? So they feel seen and heard, even if they're not using words.
Exactly, and they have this lovely example with a girl named Charlotte.
Oh, tell me about that.
So Charlotte didn't use spoken language,
Okay.
but she would hum and make other vocalizations. And by following where Charlotte was looking and gently echoing those sounds, the therapist was able to enter her world.
It's like they were creating this musical dialogue.
Yeah, it was, and it became this reciprocal proto-conversation without words.
And Charlotte's paintings from that session really reflected that connection, didn't they?
They did. The authors interpreted them as showing feelings of closeness and isolation.
Wow. So powerful.
Yeah, it really shows how much can be communicated nonverbally. And they also highlight how crucial the therapist's attention and sensitivity are.
Right, like creating that safe and trusting space.
Exactly, and they draw on Winnicott and Bowlby's work there.
Makes sense.
And then there's this whole thing about rhythm and body language.
Oh, yeah. Tell me about that.
So Condon and Sander did this research on how infants' and caregivers' movements could become synchronized.
Interesting.
And the authors found this to be really relevant to their work, even with David, where it was initially really hard to understand his cues. But when they did the video analysis, they saw these underlying rhythms in his movements.
Wow. And once the therapist became attuned to those rhythms, it was easier to connect with him.
Exactly. And the book also touches on some of those traditional psychoanalytic ideas about early infant experiences.
Okay.
And they offer a slightly different perspective.
In what way?
Well, Stern questioned some of those older ideas, like the idea of delusions of merger in very early infancy.
Okay.
And he suggested that those kinds of experiences actually require the ability to use symbols, which develops later.
I see.
So he said we should focus more on the infant's developing senses of self, because understanding those can help us see where difficulties might be coming from.
That makes sense. And that leads to their discussion of vitality effects, right?
Yeah, and this is a really interesting idea.
Remind me what that is again.
Okay, so Stern described vitality effects as these kind of in-between sensory experiences.
In between. How?
Like they're not quite full-blown emotions like sadness or happiness.
Oh, okay.
It's more like the feeling of something being fleeting or intense, growing or fading.
Ah, I see. It's more about the quality of the experience rather than a specific emotion.
Exactly, and the authors extend this to art materials.
Oh, interesting.
So they're saying that the feeling of wet paint is different from the feeling of dry chalk.
Right. They have different qualities.
And those different sensations have their own vitality effect.
And the therapist's actions can also contribute to this, right?
They can. Even their mood can have an impact on the overall sensory experience.
So it's not just about what the child is experiencing, it's about that shared experience, that intersubjectivity we were talking about.
Exactly, and they really stress that communication is happening throughout the whole process of creating, not just in the finished artwork.
Right, and they talk about how even in those early scribbles, kids are drawing with some kind of intent. And that playful experimentation is how they start to understand how representation and symbols work.
Exactly. And for kids who are already really sensitive to their environment, the therapist has to be really careful about not overwhelming them with all these sensory experiences.
Right, too much stimulation can be a problem.
Yeah. And they actually draw a connection between those repetitive behaviors often seen in autism and the schematic way that some kids draw.
Oh, interesting.
And they suggest that even just changing the art material can change the vitality effect of a rigid behavior.
Give me an example.
So like finger flicking might feel different with crayons than it does with paint.
Oh, yeah, that makes sense.
So the art therapist is really focused on that individual sensory experience with the materials.
And the goal is to help the child develop this new non-representational way of communicating.
Yeah, and to build that shared sense of awareness.
I see. Okay, what about diagnosis and how our understanding of autism itself plays into all of this?
So they talk about the DSM-IV and ICD criteria, which were the standard diagnostic tools at the time.
Right.
And those criteria really focused on three main areas of impairment:
Which were?
social interaction, communication, and those restricted, repetitive patterns of behavior.
Okay, the classic triad.
Exactly. And to get a diagnosis, you usually had to meet a certain number of criteria across those three areas. And they also point out that there's this ongoing push for earlier diagnosis.
Right, because early intervention can be so crucial.
It can, and they also bring in these really valuable perspectives from people with autism themselves.
Oh, yeah, like those autobiographical accounts.
Exactly. And they see those accounts as offering these really important insights that complement the more theoretical stuff.
Yeah, because it's one thing to study autism from the outside,
Right.
but it's a whole other thing to hear about it from people who actually experience it firsthand.
Exactly. And Donna Williams, in her writing, talks about how those diagnostic criteria can sometimes lead to stereotypes and how people might even learn to mask certain abilities to kind of fit in.
Right, like they might be really good at hiding certain aspects of their autism.
Exactly. And sensory experiences seem to be a really big part of what comes through in those personal accounts.
They are, and a lot of people with autism describe having these heightened sensory sensitivities.
Yeah. So things like touch, smell, sound, sight, and taste can be experienced really intensely, sometimes even painfully.
Makes you realize how different everyone's experience of the world can be.
It does, and Temple Grandin's written a lot about being overwhelmed by sensory input, and Donna Williams actually used the term systems forfeiting or shutdown
Okay.
to describe how her brain would kind of shut down certain senses when things got too overwhelming.
Wow, so it's like a protective mechanism.
Yeah, it is. And she talked about how important it is to connect those non-physical sensory experiences to our conscious awareness of physical sensations.
That's a really interesting idea.
And this really relates to their work with Charlotte and how she interacted with the paint and water.
Right, because they interpreted her engagement with those materials.
As a way of experiencing and processing that sensory input.
And her paintings seem to reflect her feelings of connection and isolation and even that empathic connection with the therapist.
Exactly. And this really highlights their interactive art therapy model in action.
Okay. And assessment is obviously a big part of any therapy.
Yeah, so how do they approach assessing kids with autism in art therapy?
Their approach is multimodal, so they're using observations, looking at the child's history, and sometimes using other assessment tools.